Now, I've had not a few comments and questions on the BBC article recently, which debunks ivermectin. Now, this is the study here, published on the BBC News website. Ivermectin, how false science created a COVID miracle drug. Now, I can't flick through this and show you it because it's got a lot of copyrighted images on it, which I'm not allowed to use, but I put the link there. You can flick on it and read through it yourself. So the BBC has got a really good international reputation, the British Broadcasting Corporation, because it used to be a really good organisation. So if you're outside and you haven't in the United States or something, the BBC, it's like a national institution in the UK, and it used to be really good. Anyway, they've done this article to basically debunk ivermectin. Now, it's very good of the BBC because here we all are getting a bit confused, and they come in and they do this thing. The article's called a reality check. So we're a bit divorced from reality, and then the BBC bring us back to reality, that which is true in objective empirical realism. So it's good of the BBC to do that. And this was done via two journalists. Now, on a completely separate matter, I've had a bit of a bad tummy lately, I must say. I tell you what I'm going to do. I'm going to go and see a journalist to get it properly diagnosed. They'll know what's wrong with me. And can you imagine it? If you're going for an operation and someone walks up to you in green scrubs and says, well, I'm Mr. Smith, I'm a journalist, I'm going to be doing your anaesthetic. And this is Mrs. Patel, she's the journalist, she's going to be doing the operation. I don't think so. You know, these people are journalists, and as far as I can see, these individuals are just journalists. They're not science graduates, they're not doctors, and yet they seem to have this great wisdom which they kindly bestow on the rest of us. So that's nice. Anyway, so let's look at it. This is the so-called reality check, BBC reality check. Now, but the BBC can reveal, now it's in italics, it's a direct quote from the source I am using. The BBC can reveal there are serious errors in numbers of key studies about that the drug proponents rely on. So there's something really wrong with studies that people who think ivermectin might be efficacious and safe, well, they rely on studies which have been debunked now, apparently, it would appear. But thousands of supporters, many of them anti-vaccine activists, have continued to vigorously campaign for its use. Now, what is the fact that many people are anti-vaccine activists? Is that true? They give no evidence for that. Let's take me, for example, and a lot of other people I've been talking to. We are very pro-vaccination because we want to prevent human pain, suffering and death via disease. But we're also very pro-treatment. If treatments are available, we want that treatment. I'm greedy. I want both. I want to help as many people as much as I can. That's what you go into healthcare for. Anyway, so is this a false dichotomy that's been set up here? I'll let you decide that. It could be a false dichotomy. Apparently, members of social media groups have been swapping tips to get hold of drugs, even advocating versions used for animals. Oh dear, so is it an animal medicine? This is a horse medicine. Is that the implication there? I think they forget to mention in the video, in the article rather, that 3.7 billion doses of this have been given to humans, and it is, rightly as they say, used for veterinary purposes as well. Now, I think most of this BBC article seems to be based on this study here, which is published in Nature Medicine. Lessons of ivermectin meta-analysis based on summary data alone are inherently unreliable. And I want to look at this article in some detail shortly. But for now, just one thing I want to notice. The lead author of this paper that the BBC seem to be relying on so heavily is Jack Lawrence. I'm sure Jack's a very intelligent chap. And there's a 1 there beside his name, so 1 relates to St George's University Hospital, London, in the United Kingdom. So St George's University Hospital, London, United Kingdom. Presumably a professor or a senior academic. Well, no, actually, he's a student there. These other people are academics, doctors or other academics. But to have a student as a lead author that the BBC article relies on so heavily is, let's just say some might find that surprising. I make no comment, of course. Now, large pro-ivermectin Facebook groups, again, direct quotes from the article, have turned into forums for people who find advice on where to buy it, including preparations meant for animals again. Of course, we would strongly condemn that on this channel. We should never take drugs that are designed for animal use. They could be different and different in doses. Very bad idea indeed. But anyway, so that's kind of another point that's put up. Now, we're not saying ivermectin is good or bad here. We're just critiquing this article from the BBC that debunks, because who guards the guardians? Who debunks the debunkers that have got this massive publicity machine behind them in the official media of the BBC. The BBC can reveal that more than a third of 26 major trials of the drug for use on COVID have serious errors or signs of potential fraud. I don't like the sound of that. Fraud. Potential fraud. Even the messenger of the word fraud I don't like. Now, this seems to be based, again, as we say, on this publication here, or even here. And this academic group, Jack Lawrence there is the leading author apparently. This academic group have apparently looked at 26 studies. But the 26 studies that they look at are not in this article. The critique of the 26 studies they look at are not in this article. And in fact, this article contains no research data at all as far as I can see. There's 7 references there, which we might come back to later on. It's basically an opinion piece, and we'll be talking about the opinion later, but it doesn't tell us which of these 26 articles were studied. We don't know. We simply don't know. We just know what the BBC deigns to tell us, that the BBC can reveal that more than a third, so what's the third of 26? I don't know, 8 or something. Major trials of the drug. So presumably the other 2/3 are okay, but they don't say that. It's a group of independent scientists. Phew, thank goodness for that. Led would appear by a student, but it's a group of independent scientists. The group of independent scientists examined virtually every randomised controlled trial on ivermectin and COVID. The group of independent scientists examined virtually every randomised controlled trial. Well, I thought it said they measured 26 of them, but there you go. Do the BBC think that 26 is nearly all of them? I don't know. Now, this is a social media group, apparently. It's a Twitter group. So this international group of scientists is in fact a Twitter group. Now, this is not saying that what they're saying is good, bad, or indifferent. I'm just reflecting on what the BBC has said here. I'm more than happy to talk to this group, and I'm sure they've got some brilliant opinions to share with us, which we'd love to hear about, but we simply don't know what their opinions are because the BBC don't reference it. They just give a few random quotes. Anyway, that's one of the social media groups. This magazine here says that's how they all met on Twitter. So it seems to be a Twitter group. Nothing wrong with that. It's a Twitter group. So it's not an international formal group. They've been working together remotely on an informal and voluntary basis during the pandemic. So this is the international group of scientists that the BBC is referring to. So we'd like some references, please, from the BBC. Now, in this article, of course, the BBC give no references, which is just... well, it's nothing short of pathetic, is it? But they give no references. Although I managed to dig around and find out some of what they were talking about. The BBC can reveal that more than a third of 26 major trials of the drug for use on COVID, that's ivermectin, have serious errors, signs of potential fraud. What is a third? It's 9. It's just under 9, isn't it? 3. So basically it must be saying that 17 or 18 of these trials are okay, but there's a few dodgy ones. Of the 26 that they reviewed would be an possible inference from that. Let's go on. A recent study in Lebanon was found to have blocks of 11 patients that had been copied and pasted repeatedly, apparently. So they've picked on one study from Lebanon here. But they've retracted that, so that's been retracted. What study are they talking about? We don't know. We could well be that one. That's just me searching around, seeing what I can find. Could be that one, but that one doesn't seem to be retracted. So normally if a study's retracted, I'll have retracted over it. So again, what study are they talking about? Don't know. They don't deign to tell us, but we don't need to know that. All we need to know is, surely their conclusions are good enough for us. We don't need to know the evidence, do we? Then there's a study from Iran. Now, the study from Iran they're talking about, I think, is probably this one. Again, they don't tell us. This is just me putting some names together and looking around. I think they're probably talking about that one. It's got the same lead author that they mention, and it's got the same information where they're looking at looking oxygen saturation levels. So it could well be that study, but we don't know because they don't tell us. But apparently the records of how much iron was in the patient's blood contained a number of sequences that was unlikely to come up naturally. Okay, they said. The doctor in charge of the study, said, who led the study, defended the results and the methodology and disagreed with the problems pointed out to him. So there's clearly a scientific debate going on here, but how much iron, of course, is not the major parameter. I mean, iron's important, of course, for carrying oxygen, but I'm not sure that's the main point of the study. Anyway, this doctor from Iran added it was very normal to see such randomisations when a lot of different factors were considered. So a legitimate debate of science there, but I don't think there's enough to debunk that article, even if some of the figures given for the patient's iron and haemoglobin levels were inaccurately reported. What about the rest of the study? They don't seem to comment on that. Now, the BBC article does say ivermectin is generally considered a safe drug, although there have been some reports of side effects. Well, yeah, imagine that, a drug that has side effects. Well, we have looked at ivermectin on the Vigi base before and seen it's a remarkably safe medication. That doesn't tell us whether it's efficacious in COVID or not. It just tells us it's been safe in the 3.7 doses, or essentially safe, relatively safe compared to other drugs, or safer than other drugs. The other drugs we compared it to from memory were acetaminophen, ibuprofen and amoxicillin, which had many, many times more adverse events reported about them than ivermectin has. So they agree, but there are side effects. So, and then they go on to talk about the horrendous reports that we've had from the United States of people taking huge doses of animal intended ivermectin and getting overdoses and having to be hospitalised. So again, clearly ludicrous taking animal ivermectin, but that tells us nothing about what human ivermectin is good or bad or not. But indirect harm can come from giving people a false sense of security. Now, I agree with this, especially if they choose ivermectin instead of seeking hospital treatment for COVID. I agree with that, or getting vaccinated in the first place. I agree with that. But those three valid points there, again, tells us nothing about the efficacy or otherwise of ivermectin. We are no further forward on that. It tells us nothing. Some groups regularly contain posts about conspiracy theories of ivermectin cover-ups, as well as pushing anti-vaccine sentiments or encouraging patients to leave hospital if they aren't getting the drug. Again, yes, all these things are bad. It's bad not to get vaccinated. It's bad to push conspiracy theories. It would be bad to leave hospital if you're not giving a particular medication against the advice of your doctors, of course, but that tells us nothing about the efficacy of the drug again. It's another red herring. And then they conclude the article with this terrible story about a South African nurse that died. Apparently, instead of consulting a doctor, she continued with ivermectin and home oxygenation and sadly died. So this is one tragedy in South Africa. But the whole point about research is we can't extrapolate general principles from specific instances. We have to take the specific from the generalities that only research can give us. We must think deductively, not inductively. We must think from the general to the specific, not from the specific to the general. So I would suggest that the BBC has put forward a classic example of invalid inductive thinking there. If the journalists want to get hold of me to argue that point, of course, they're more than welcome to do so. Anyway, what's the BBC study talking about? So I've looked all over for this paper on the 26 studies, and it simply doesn't exist. So what we have to conclude here, unless I've spent about an hour looking for this all over with every possible search I could find. This group of 5 academic Twitter friends do not seem to have published their results on their analysis of the 26 studies that they have analysed, where they found a third of them were probably inaccurate or fraudulent. It doesn't seem to be published, so we don't know what it is. So the BBC is quoting unpublished evidence. which I find, I must say I'm surprised. It's surprisingly bad practice. Arguing from unpublished evidence. I mean, it's one thing to argue from peer review evidence. It's another thing to argue from preprint paper evidence before peer review. But to argue from no evidence at all, which appears what the BBC seems to be doing. These are direct quotes from this study that the BBC... So this is the only study I could find written by these 5 international cyber friends. This is the only one I could find. Seems to be the one that the BBC is talking about. And this is it. It is just a discussion paper on the practicalities of doing meta-analyses. Now, this Elgazar study here that you mentioned here, I don't know why they've referenced that. What date was this published? So this 22nd of September. So this study here by Elgazar was retracted weeks ago. So why on earth would they quote a source which has been retracted? I'll let you read the paper and see if you can work it out for yourself. But that's been clearly retracted, that. And this Elgazar one, again, retracted. So that puts the references down to 5, doesn't it? That study did have methodological flaws that I believe this student did identify, actually, to be fair to him. And it has been retracted. So not a problem there because it's been retracted. Anyway, going on to some of the things they said. We recommend that meta-analysis. We recommend that meta-analysts, those who study meta-analyses, who study interventions for COVID-19, should request personal review IPD independent patient data in all cases. So rather than getting the results from the study, they recommend that everyone who does a meta-analysis should go back to the individual patient data. I think that's a brilliant idea. The point is this data is simply not published, and this is not possible. This is not done on any other studies that I've ever come across in my entire life. So they're asking for something completely, in my experience, and I must have been reading meta-analyses for about 30 years now, that I really have never come across before. This has been reduced to individualised patient data. It's not the way meta-analyses work so far, in my experience. In a similar vein, all clinical trials published on COVID-19 should immediately follow best practice guidelines and upload anonymised IPD, independent patient data, so that this type of analysis can occur. I agree, but again, this is simply not done. So they're recommending it should be done, and I agree it would be a good idea where it's possible, where it doesn't compromise patient confidentiality. If that's possible, if it's possible, it would be a good idea. So scientifically, both of these things are good ideas, but they're simply not done. Any study for which authors are not able or willing to provide suitable anonymised IPD should be considered at high risk of bias for incomplete reporting. So basically, all the meta-analyses that have been done in the medical literature up to now, according to this line of thinking, have to be considered at high risk of bias. So we always were taught that the highest level of evidence is a meta-analysis of randomised double-blind controlled trials. So it appears that's no longer the case now, because all the meta-analyses of the randomised controlled trials over the past 20 or 30 years have not contained, or nearly none of them have contained independent patient data. So it looks like most of the things we thought we know, we in fact don't know now, according to the logic of this study as I read it, which of course would cause quite a lot of confusion. So basically what I'm saying is, yeah, it's a good idea in the real world, but it hasn't happened so far. Yes, of course, this is a brilliant idea, but is it going to happen? Probably not. Has it happened already? Not very often, or virtually never. Oh, in fact, look, they say that. We recognise that this is a change to long accepted practice and is substantially more rigorous than the standards that are typically currently applied. Okay, so what about all the information we currently have? Do we disregard that? That's not mentioned. And I again stress that this is all just information from this short opinion piece from these 5 authors. We recognise that by recommending independent patient data review by default for meta-analysis of potential therapeutic agents of COVID-19, we are calling for a change nearly universally accepted practice over many decades. So the universally accepted practice over many decades, they're not happy with that. They want to change it. So presumably that means we need to rip up every meta-analysis that's been done over the last 20 or 30 years. In fact, since I've started reading meta-analyses, because it should be considered high risk of bias. This is clearly talking about an idealized world that simply doesn't exist, as far as I can see. So there we are. Now, I could carry on with a lot of other things. It's always hard to know where to stop on these. I'll give you one more thing. A large part of the problem is that, yes, a lot of the studies that have been done on ivermectin are led by clinicians. Yes, there's been some deliberate fraud, it would appear, in some cases. But most of the research has been done by clinicians, by the doctors and staff pharmacists and things themselves. And of course, they're not full-time researchers, and of course, they're busy with the day job anyway. So, and they're not professional researchers necessarily. So it's very hard for these people to do that as they go along. Whereas perfect clinical, well, near perfect randomized controlled clinical trials, like we had for the vaccines, they're conducted by Big Pharma in collaboration with multi-million-dollar budgets. So really, to compare one with the other is simply not fair. We have to take the evidence and put it together as we can find it. And that is what we see on this group here. Now, this group is a bit mysterious. We don't know who they are, but they're a group of interesting academics. But what they've published seems to make sense. So this is the sort of real-time meta-analysis of 64 studies here. Slightly more, 64 studies. They've obviously taken out the Algazar study. So what happened is when studies are proved dodgy, this group here, now I don't know whether it's daily or weekly. I think it might be weekly, but every week they like rerun their analyses, which isn't that hard. You just click the button on the computer these days. And if there's a dodgy study, they simply delete it. Then the computer just reruns it and they get a different analysis. So the results I'm about to show you do not show the fraudulent Algazar study from Egypt. They simply don't have it. So this is basically a lifetime meta-analysis, which is I've given you a reference for, unlike the 26 studies by this other group, which is not referenced and, as far as we know, completely unpublished. So this is a really interesting site. I've put the links there. Do have a look at it, of course. While many treatments have some level of efficacy, they do not replace vaccines and other measures to avoid infection. Of course not. This is exactly what we are saying. So let's just look at roughly what they're saying here. So they give all these meta-analyses. Now, this line in the middle here is no difference. This would indicate that the treatment has a good effect. This would indicate that the treatment has a bad effect, basically, on that side there. So this is ivermectin early treatment and prophylaxis studies. And there they come up with a 66% improvement from their analysis. Yeah, that's right. Yeah. Oh no, that's early. Yeah, that's right. So if it's given, ivermectin. This is basically early treatment and prophylaxis. So if it's given early in the course of an illness, 66% improvement is the result of their meta-analysis, which is at least published, and we can go and read all of those for ourselves. Unlike the mysterious 26 that we're not told about by the BBC, at least. Prophylaxis seems to be 86% improvement there. With ivermectin on those studies. All analyses, 75% improvement. And it gives you huge amounts of meta-analysis results, data. So definitely showing positive results from that meta-analysis. Whether that's right or wrong or not, that doesn't really tell us, but it tells us the result of this meta-analysis is this particular meta-analysis is positive, and at least that's published for us to have a look at. So we mentioned this problem with clinical trials. Now, this is a quote from the Japanese Journal of Antibiotics. Now, excuse my pronunciation, Japanese listeners. Kitasho University said this. This is a direct quote from their article. Based on the judgment that it is necessary to examine the clinical effect of ivermectin to prevent the spread of uncertain COVID-19, this university, Kashato University, asked Merck & Co. To conduct clinical trials of ivermectin for COVID-19 in Japan. Now, we should understand that the university, Kishato University, was going to give them their facilities and infrastructure, and we understand that they're linked with a lot of the national bodies in Japan, so they could have facilitated a clinical trial there, which makes perfect sense. Why did they go to Merck about this? Well, this company has priorities to submit an application for an expansion of ivermectin's indication since the original approval for the manufacture and sale of ivermectin was conferred to it. And we know that Merck very generously indeed has given millions and millions of doses to help eradicate scourges of parasitic disease in the developing world. So full marks to Merck for its track record on ivermectin in terms of facilitating its availability as an anti-parasitic medication. So you would imagine that Merck would jump at this chance, wouldn't you? You would have thought. Anyway, they said, however, the company said it had no intention of conducting clinical trials. Now, a cynic might say that's because ivermectin is out of patent and you can't sell it and make a profit for it because any generic manufacturer can make it. But what do I know? I don't know. So that's the paper from the American Journal of Therapeutics, and these are the authors. Now, it looks like this is the lead author here. Looks like that's the second author. That's the third author. It looks like this is the third author. The third author is a Dr. Satoshi Omura. And Satoshi Omura works at Kishato University, or is associated with it, it says there. In fact, he works at the Omura Satoshi Institute, Memorial Institute, because this is the man who won the Nobel Prize with Dr. Campbell in 2015 for his discovery of ivermectin. Along with William Campbell, jointly won the Nobel Prize. So fairly reputable authors there, really. But Merck didn't want to play ball with the Nobel Prize winning university, it would appear. Which is a great pity, because that would have given us a really high quality pharmacological industry led clinical trial. We'll leave that there for now. Thank you for watching.